Hi, welcome to the Medicare Show. I'm your host, Jeffrey Kuhn, your Medicare advisor. Got an interesting episode today. It's currently October 16th in 2024, and this is really about some of the surprises I've encountered since the start of this year's annual election period, which just started yesterday. All of our clients and a lot of other people out there we've been hearing from have been getting different notices regarding their plans, and the process starts of what to choose for next year. The biggest shock and surprise, and timing-wise, different companies, probably some of the most popular, I've mentioned this in other podcasts, have sent out termination notices of very, very popular Advantage plans. And those termination notices went out, the end of September. I know that I got an email that one carrier was going to send them on October 8th. Please don't notify your clients. Well, they need to know. And the process begins. So these plans are gone. As a reminder, if people don't notice that you've got a termination notice or you're in a plan that's getting terminated, because I'll tell you, people are not looking at the mail. There's so much stuff that comes. January 1st, I can't reiterate this and say this strong enough, you're going to find yourself an original fee-for-service Medicare with deductibles and coinsurance. More importantly, you're going to be responsible for 20% of all your medical bills and have no prescription drug coverage. That's a real problem. What am I seeing more this year than I've probably seen other years? I got clients and people coming in, talking and looking at this book, trying to make a decision about what do I do for 2025. They've got a lot of the local plans that are available. Some, depending where you live, might be out of the region based on your county. But looking in here, is it a good resource to use or not? The Medicare book. I think one of the areas that I'm most concerned about, what I've seen, is clients that have plans that are terminating. They're looking in this book, or they're looking at the brochure. Some of these other these insurance companies are sending them about their plans that are terminating. And they're saying, well, I'm going to pick another plan. Zero premium is really important to me. This plan looks pretty good. It's got low copays for my primary, for my specialist. Looks like it has a decent dental benefit. What do you think? I look at it, the first look at it, I go, it looks like a decent plan. Not in this book. It's something more specific with all the benefits. As I started looking through it, all of a sudden, the yellow flags started coming up, which quickly turned to red flags. And I made sure that I read through all of the benefits, right? What's covered, what's copays. And in my head, I know where everybody is with their fee structure. And my first thing was, this is now completely a no-go. And if I had a client that wanted this, I was going to have a letter that the client understood they were going to be responsible, 20% coinsurance for things that they were paying copays for, that most of the other really good insurance companies have copays for. And I'll tell you what, it started with ambulatory surgery, outpatient surgery. Most good Advantage plans, you should have a copay for these things. This insurance company tried sneaking it in, coinsurance. 20% you have to pay the cost. Outpatient surgeries are not cheap. Your anesthesia, ambulatory surgery, they keep you at the hospital overnight. So instead of having a flat copay, and that's how most things are done today. I can't tell you how many people have been in the hospital for 3 days, they get released, it's all outpatient. They pay $3 to $4 copay, it's done. This, you're paying 20% of the cost. Diagnostics, MRIs, CT scans, blood work, X-rays, like the list went on. I go, these are the most common things your doctor is going to order. You're now going to pay 20% of them, and you're subject to a $9,000 out-of-pocket max. There's now a real high likelihood you may hit that if you have something happen or need some of these tests. So you got to be really careful. They're hiding these things in with these plans. This booklet, I just don't think for choosing plans is a great resource. You look in here and say, okay, what am I looking at? Premium, and people look at copays, and okay, I've got an out-of-pocket max limit. One of the carriers is over $9,000. I just opened this up, and where it opened up. Primary care copays, specialist copays, chemo drugs, other Part B drugs, home health care, durable medical equipment, your Part D deductible. What am I not seeing? I'm not seeing the things you use or really need coverage for right? It's not your primary care doctor. It's not your specialist. The things that cost you the most, MRIs, CAT scans, right? Outpatient surgery, ambulatory surgery. Those are the two most important things. Please pay attention. That's my biggest surprise with this. I got people that are looking at plans. They're just not a good fit for anybody because of the risks. I said there's much better options. When I explained it, they absolutely understood it and it makes sense. That's probably one of my biggest surprises. The prescriptions, the amount of confusion that's around the Part D plans for next year, but it's the amount of plans that are terminating. In Rochester, New York, in the area, last year, I just did a search on Medicare.gov. You can look this up yourself. Looked up Medicare Advantage plans in the zip code here. There are 40 available, or there are 40 currently available for 2024. That number drops to 33 next year. That means 7 plans are getting terminated. There's a lot of people don't realize this. People that are looking at their mail are getting the notices. The people that we have in our communication list or an email list, we've already sent them all notices saying, FYI, your plan's terminating. You've got to make another selection for next year, and we can certainly help you with that. So pay attention to that. That's probably one of the biggest, again, things I've seen for next year. People aren't paying attention to their plan changes. The other thing that kind of goes hand in hand with that when you're talking about coinsurance is I'm seeing some of the drug plans now going from co-pays to coinsurance, which may cost you a lot more. It could cost you less. They do that because they know you're going to pay more. They'll pay less. The other thing that they're doing is they're increasing the amount of coinsurance. A lot of them had tier 4 medications at 25% coinsurance, and they're going up to 50% coinsurance. A lot of those prescriptions, they're $600, $1,200 or more. You're going to pay 50% of that, so you hit your $2,000 out-of-pocket max. The surprise is people aren't picking up on this. When you've got a prescription that has a copay, not coinsurance, and next year with a $2,000 out-of-pocket max, you very well may pay less. I'm going to talk about that in another podcast with a couple specific examples of prescriptions, but no, don't use this. You got to look at everything. Don't just rely on this and picking a plan. It's incomplete. It doesn't give you the big picture. It's got plans in here that I know a lot of the doctors and hospitals don't accept. Completely out of network. It's your responsibility to get reimbursed. So be careful this year. Read all the details. If you have any questions, call us. I'm here to help you personally. If you've got questions or need help deciding with available options, what's the best fit for you. There's still quite a few choices. There are good ones, don't worry, but I don't want to see anybody ending up in a bad situation, and that's not hard to do with what's happening with all the changes coming. Thanks for joining me. Take care.